Trauma is when your biology is assaulted in such a way it may not be able to re-regulate itself. It's often manifested and reported in the symptoms of depression, anxiety, agitation, irritability, isolation, racing thoughts, hypervigilance, scanning, difficulty sleeping, the worsening of addiction or the onset of addiction, avoidance and numbing behaviors, suicide ideation and despair, and the list goes on and on. The worst part, many people begin to believe that they've lost their mind and they're never going to get better. As a trauma therapist, I'm here to tell you, you can get better. And that the most optimal form of trauma therapy must include a brain-body centered psychotherapy technique. That talk therapy alone is not the most effective form of therapy for trauma. And for some, it may actually be re-traumatizing. Remember that trauma can be a single event, or it can be the accumulation of events throughout your life. So when you're seeking help, interview your therapist and ask them what their experience is in treating trauma and what techniques do they use. Please remember that if they rely solely on talk therapy, that talk therapy alone is not the optimal form of treatment for trauma, that it can be re-traumatizing, and at best it can be a form of benign therapy. And what I mean by benign is simply this. The relationship you have with the therapist may be a trusting one, and you may feel safe with them, and that's critically important. You may make insights and progress in the session and hold on to that information for a day or week or weeks. But unfortunately, in the big picture, you can't hold on to the progress. And you loop back into the same traumatic events and symptoms that brought you to the therapy to begin with. So I am asking you, please do everything you can to advocate for yourself and find a therapist that gives you compassion, trust, and understands that trauma must include brain-body centered psychotherapy techniques. There is hope. Don't give up. You can find me on LinkedIn, Facebook, and Trauma Line 1, Bonnie E. Owens, LCSW, PC. Take good care of yourself, and remember, there is hope.